two psychiatrists rapping about our lives and work.
This podcast is not intended to be medical advice. Any stories we use have been altered to protect identities and sensitive information.
This is intended for entertainment purposes only.
You know it!
Ow!
Welcome to the Good Shrinks podcast.
Hey, T.
Hey, C. Let's talk about COVID.
Let's talk about COVID.
You know,
all the good things and the bad things
that happened.
Let's talk about it. Let's talk about COVID. So, I think particularly for us, I will say kind of working in an emergency setting, we were, I guess, considered first-line workers.
Yep.
And we were there, and we went through the whole thing, and I think it might just be interesting for other people that maybe don't work in mental health or in healthcare just to hear kind of our experience of it, and just for us to process it, because it was a whole thing.
A whole thing, and I feel like I've just never really debriefed. We just sort of continued on, and we're sort of in this post-COVID, not post-COVID because COVID is still out there, but the post-emergency or the post-pandemic aspect of it. But I was just glued to my television the whole time and just filled with, I already have kind of a baseline level of anxiety, but then with that, I don't know, it was just this existential crisis. Like I had this fear that as soon as I went into the emergency room, whenever I went back, I was going to get COVID and die, because that's all you saw on the news was how people were dying, and that's how they covered it.
And it was so severe in the beginning. It's kind of a joke, but even in residency, I would always think, like, if there was ever a zombie apocalypse, we would be first line. We would be there. We would be the first ones exposed to it.
We would be the ones.
We'd
be the first zombies.
We would be the first zombies. Right. And so, when COVID happened, the world kind of shut down, right? Mm-hmm. So, with the world stopping, you would go to work and, like, there was no patients coming in, which was weird. It was just, like, no one. It was like a ghost town. That's talking about the first, couple of months. Mm-hmm. And there was just a lot of uncertainty.
You remember all the email chains, about it would change daily, what we had to do, how we were supposed to report things, how we could keep people in the emergency room.
Precautions, what type of mask to wear, when to wear them, whether you wore them just seeing patients or if you had to wear them sitting at your desk even around other colleagues.
And that was really weird, wearing a mask all day at work.
Yeah.
Try just the actual logistics of it and keeping it on your ears, and you would see the pictures of people. Luckily, we did have N95 masks. Mm-hmm. The dents in your nose and your face that you would get.
It would be so hard to wear that all the time. It was so uncomfortable. We have a room that's kind of just like an office that you can go and type notes, and I would kind of disappear from the setting to go type notes there just so I could take the mask off, because it became suffocating at times. Mm-hmm. As patients started coming back into the hospital, it was almost a mentality too of you're in an acute mental health crisis, great, we're going to help you. But if you're coming in and asking for a refill, it's what are you doing? I'm there's a full-on pandemic.
Yes, I would become so angry. Mm-hmm. You are risking not only us, not only you, but us.
Yeah.
For what? Why could this not have waited? Or, especially if people were coming in and saying, I have COVID, but I also need to do whatever. And that, I understand that people need things, but we're talking about life and death.
Yeah.
Again, in the early days of this.
We're talking the early days of the pandemic. It's if you need a refill, call it in. Don't come to an emergency department, potentially risk first contracting it.
Yes.
It was just really interesting seeing some people's lackadaisical nature related to it when, you turn the news on and it sounded like the sky was falling.
But again, remember, we live in a world where some people believe things and some people don't. That was the constant thing going on too, is that the people that were coming in and refusing to wear a mask because they didn't believe COVID was real, and then us still having to treat them, always having to reconcile all of our personal feelings and biases and all that stuff whenever we see people.
Something else, T, that I thought was interesting is COVID caused a lot of anxiety for people. I can't tell you how many individuals I saw coming in for anxiety because they were worried they were going to catch COVID. And so they came to a place, a medical building, where it's like literally probably 50 feet away from you. I was like, what are we doing here? I mean, it was, and it was.
If you didn't have COVID before, you got it now.
I mean, you're right there at the door. But I mean, it was interesting because I mean, it was not just one. It was maybe even hundreds of people that I evaluated. That I was like, I hope being here is making you feel better.
You have exposed yourself.
Logistically, it may not be the best place to be, but so I thought that was interesting. The other perk I thought for us, I don't want to say perk, but is we still were going to work. So, I had a lot of friends that literally for months never left their house even once. Even though we would go into a high stress situation, at least like I got to leave my house for a few shifts a week. But then I would also be very, very grateful when I would work from home remotely because then I wouldn't be putting myself at risk.
I mean, I had developed this whole system of going through the garage and taking off my clothes before I even went in the house, washing my hands and, doing everything, wiping things down. So I had a very clean house back then. Wish I could get back into that mode. Yeah, it was just it was a different time. It was like apocalyptic in a lot of ways.
And like you said, things were rapidly changing, constantly getting emails from hospital system of kind of expectations or what we're supposed to do to keep ourselves safe. And it was just always a changing narrative. It was hard to kind of keep up with even because everything was changing so rapidly. I mean, I do remember when we finally, had the vaccine and we got the first dose of the very first vaccine. I just felt so relieved because I was like, well, at least now, this won't be something that would potentially kill me, right? I may be very sick, but at least I will survive.
I mean, I went all through that first wave. I never got COVID. And so I was starting to feel like I'm immune. I've got a super immunity. Maybe they should research my blood because I never get COVID. I'm surrounded by it. I mean, my husband and my daughter got it. And I'm in the house with them, and I had to take care. This was in the early days where, she had to be out of school, and he wasn't working, and so I had to take care of them, and I was in full gear at home. I worked remotely because back then you couldn't, if you were around somebody that contracted it, then that would excuse you from work. I was the whole time thinking, I'm going to get it next, and they got a mild form of it. She didn't even have any symptoms. She just happened to... We tested her once he was positive. I was negative. I stayed negative through that whole thing. I didn't get it until this past summer.
Oh, wow. So you've been in a really long time.
Yeah.
I didn't get COVID until I think it was a year and a half into the pandemic. So at that point I think it was actually the Omicron strain. So it wasn't as bad. Well, at the time I was kind of fearful of, there was starting to be reports of people that were getting residual symptoms after COVID. And now it's called long COVID, right? People have different perspectives. I definitely think there are individuals that have residual symptoms, kind of similar to people that have dysautonomia or their bodies never quite self-regulate the same after, they can just have kind of residual symptoms from a severe illness. Kind of nervous about that, just something happening kind of permanently. Yeah, it was tough for us because I think, we were forced to go into situations where we would be very close with COVID patients. Even working in mental health, you don't know. I mean, we would test, but even back then, the tests were a lot slower. Sometimes you would learn after the fact. It was more stressful. I mean, obviously that kind of reduced over time, but it did have quite a bit of impact, I felt like, on just the anxiety of going into work and then you not wanting to get your friends sick or your family, in case you did go see your family for a dinner or something, you would be the one that would potentially expose them. It was just difficult. I
feel like it's sort of that anticipatory anxiety. It's always worse when you're thinking about what if ahead of time, and then once you actually go through it, it's not as difficult as you thought. For some people, I mean, some people it changed their lives or they died. So
you didn't really know how you would react to the virus.
That's where the anxiety was coming from. It's just too many unknowns. It just felt like it was this juggernaut, almost like a comet that was coming to the planet.
Yeah.
And it just depends on where it hit as to how much devastation you would have.
And something that you touched on kind of earlier in the podcast, the pandemic indirectly had quite a bit of impact on society.
Yeah.
After things sort of opened back up, kids were going back to school, adults were going back to work. We noticed an intense influx of patients.
Yeah.
I mean, people were really having to adjust to going back to routine and you know, to their lives in some sense. I mean,
and a lot of breakups.
mm-hmm.
I think having all of that time together for some people, a lot of stuff was sort of revealed.
Yes.
And they made decisions, decisions.
Yeah, I'm sure there's quite a few people that were in, you know, sort of COVID relationships, let's say. You know, they were kind of stuck at home and there wasn't really, you couldn't really date during COVID, right?
Right. But I mean, people who have been married for like 20, 30 years, now that they're having to be in each other's space all the time, I think that kind of destabilized the relationship. I mean, like people who've been married a long time, or maybe not a long time, but they just haven't had that forced being around each other all the time. And it just sort of exacerbated whatever little flaws there may have been. Now they're like huge boulders they can't get past. You saw a lot of divorces. Other times it's a blessing.
Yeah.
People need to have that freedom.
I mean, even I was in a relationship at the start of COVID that probably went on like a year longer than it should have, because like we ended up living together and it's like I can't kick you out during COVID. I mean, it wasn't horrible by any stretch. It definitely prolonged that relationship. You know, I think we were all kind of on a delay. Like I even hear people nowadays say, oh, how old am I? Oh, well, those years didn't count. You know what I mean? Because it feels like it was just like everyone was stuck in time for at least a couple of years.
Absolutely. I feel like, you know, I was myself glued to the television every day. Was watching either something from the White House or something from New York with updates about, I mean, people were dying. People were dying. There were bodies behind these hospitals, you know. They didn't have room at the crematoriums. It was just like a war zone, literally. And my thought was, oh my gosh, I have to go back to that hospital and I'm going to catch COVID and die. You know, like that was my fear the whole time. But knowing that we had to go back and take all the precautions that we did, unfortunately, I got COVID, but I didn't die.
Absolutely. I remember like the first patient that I encountered with COVID, because like we would do work in behavioral health, right? So it's kind of like, well, how quickly are we going to see it? I mean, there was a lot of health anxiety even for us. I remember this lady, she was homeless. She came in for another reason. Part of it was malingering. She didn't have a place to go, and then she tested positive for COVID. Before I went into the room, that I learned that she had COVID, and I gowned up twice. I put on so many sets of gloves, like triple mask. Like I went into the room and like stood in the corner and just was so nervous about catching COVID. And that was just like one encounter. I mean, I can't imagine like you know, medical emergency physicians that were seeing it every day.
You didn't have to imagine it because they were showing you on CNN and you know, all these channels, these doctors that were living basically in the hospital in these uniforms in all of this protective gear, and like, do I have enough to protect me? But yeah, we weren't in the intensive emergency sort of environment, which, you know, but people still floated in there with, I mean, COVID is COVID.
And, you know, since this is supposed to be us and having fun, one thing that I thought was funny is that most of the medical staff, the providers, did not catch COVID. And, like, all of the ancillary hospital staff who supposedly were working from home caught the COVID.
Yeah.
All right? How did that happen?
One funny image I have is of you when you described yourself up against the corner like Ghost Dr. C.
Seriously, I was like on the wall.
Yes, I am hovering. Have jujitsu power.
Exactly. But, you know, kind of going back, like, once things reopened, I would say, you know, really with children, I mean, there was quite an adjustment for them of returning to school. I mean, it was very much like a hardship. And it makes sense. Imagine being, you know, in elementary school, middle school, and then being able to take 2 years at home. I mean, that's almost like a dream come true, right, when you're a kid. And then having to kind of go back to more of a structured setting. A lot of kids really struggled.
I saw a couple of cases where the kids who were in high school were really, really, because, you know, think about it, this one kid had planned to go to an Ivy League school, had grades were great up until, and it was like 11th grade. So missed 11th grade, did things from home, but couldn't keep that average going. And then now they're in their senior year trying to apply to these schools, and just was devastated because, their GPA had dropped and they lost all of this like future that they saw for themselves.
This is maybe deviating a little bit, just thinking about working from home, right? And, it cuts down transit time, even getting ready for work time. You lose time of having to break room time, intermingling with coworkers. You can maybe focus a little bit more and be more concise. Then on the other side of things, like businesses are saying, well, my employees are less productive when they're at home. And, I do think that thinking in the past of friends that worked at different kind of ventures and corporations, like it seems like corporations or businesses that had like health centers on site, like gyms or game rooms, they always seem to love their job the most. I think there's maybe just less stress on them, maybe, I don't want to say to produce, but giving them a little bit of sense of freedom really does affect how a person views their workplace.
Absolutely.
There's a whole world of corporate health that we don't even know about, but
like the Google and the Facebook
Yeah.
people and like how they work.
Mm-hmm.
Disney maybe, or what was that animation part of Disney? Pixar.
Yeah.
Yeah, they have like that whole open concept workplace. But I imagine you have to be a pretty organized person to be there, because I'm sure eventually you do have to produce
And
something.
show your worth is, in a sense, to some degree at the job.
And those are creative people. Like, they probably look outside the box for lots of different ways to get inspired.
So even I feel like in a hospital setting, like having a little bit of freedom to go work out for 30 minutes in the middle of a shift, I feel like Big Brother is always watching. I mean, that is what's causing a sense of burnout among providers, is like there's not so much of a sense of freedom at times of kind of what you can do throughout the day.
Yeah.
And so just something that's interesting.
Yeah, I wish things were not based on time, because especially our job, it requires time to sit down and talk to people, to build a rapport, to come up with a plan, and discuss all these things, discuss the costs and the benefits of medicines and therapy, and discuss what the illness it might be. And, these things take time. You can't just blurt out, in 15 minutes for your visit, okay, I think you have schizophrenia, take these medications, come back in 6 months. Next.
Yeah.
Like that doesn't fly. So I think we have to come up with something more elegant in terms of compensation workflows.
Yeah.
That's not time-based, because at least for our profession, I feel like time is part of what we do. I mean, time is what we need to get to the information that
you lose some of the humanistic aspect of just you as a person and value as an employee. I mean, I'll just say it, like, in my mind, there's just some MBAs behind a spreadsheet. You got these spreadsheet warriors that are trying to create increased productivity to increase value for their own job, or a sense of value for their own job, but really it's like at the detriment of your providers who have spent 35
on the front lines doing all this work.
Doing the work. And I mean, it just seems
being
like,
exposed to the dramatic stories of all these people.
It can make you feel demoralized. So it's like, well, sorry, I spent 35 years of my life to get here, but now it's like,
it's not appreciated.
Yes, that's what I'm looking for. Yeah. And so I think that takes away the humanistic aspect of provider-patient relationships, and then it becomes more numerical, getting set number of patients done. What was the value on this return survey? I mean, it's just, it becomes so impersonal feeling that it's like, well, like, where's the value for the patient? Where's the value for me? And even for the value for the corporation, like, what is the goal, right? And I know I'm going off on a tangent on something unrelated, but it's something I think that we all kind of feel. Maybe at some point there'll be more of a provider-run practice that might be a little less skewed towards these things.
I mean, I think that they exist, people who work in private practice. I just have avoided private practice primarily because I like the idea of not having a caseload. Like, one of the reasons that I'm in the emergency room is when I'm done, I'm done. Once that note is done, I'm on to the next person. I don't have it's not like follow-up needs to be done. And I think a
Yeah.
person who is an outpatient doctor, that's their thing. They're following up with these people. And then the other thing is that we have so many benefits through our employer in terms of malpractice insurance. I mean, you'd have to just figure all that out on your own when you're doing private practice.
That is a lot of things that I can sit here and be like armchair psychiatrist, be like these MBAs, but really that is a whole side of things I really don't know about. And probably once you go down that wormhole.
Yeah, they have a lot. They're accountable to somebody, so they're trying to streamline things. But I think it's unfortunate when they are trying to do things that take, again, that time element, because the time is part of what we do. I mean, yes, sure, I'm sure there are people out there that would just see one person a day and just talk all day, and if they didn't have some kind of limit. But I think in general, we all are trying to do a good job out there with people who are in crisis, and we do what we can.
Kind of tying back to COVID a little bit here, and speaking of kind of like your perception of maybe to patients and society, obviously during the COVID pandemic, in the beginning, it was like healthcare warriors, right? There was a lot of positive public perception. What was sort of your feel on that when hearing those things?
I enjoyed it. I cried half of the time, I would see, and a lot of it was out of New York because a lot of things were going on in New York back in that time. But they would have those segments or programs about the doctors. I mean, I was overwhelmed by how brave, all the doctors and the nurses and all the staff in the hospital settings that were exposed, how their resolve was, we are going to see these people, we're going to treat them just like we would any other time. We're going to take these precautions, but that's our role and that's what we're going to do. And you would see the city, people would bring them food, or people would make those banners, or at a certain time every day, like at 7:00, somebody would ring a bell or something in the town, and everybody would just start, clapping just out in the, different parts of town just to thank the healthcare workers. I felt like that was so moving. So yeah, I definitely liked that.
You really make you feel appreciated and seen in a sense, and in a tough situation.
I mean, risking your life, basically, before the vaccine.
Yeah,
you didn't know what was. Yeah, you didn't know how it was going to go down. So.
Yeah, that's true. And so it was a little bit of a gamble, right, for us as healthcare workers. So that was kind of nice to hear, and obviously, I think everyone did appreciate that. It was interesting though, kind of seeing the tides turn a little bit in society as the vaccine was coming out, and then. In my mind, I anticipated America to come together and be like, yeah, let's stomp this out. Let's all get the vaccine and be done.
Like the World War II veterans.
World War II. Yeah. We all rallied together. Where was the nationalism? I mean, we were so divided. I was it was so bizarre. I get it was a new vaccine. Anything new can be a risk, right? But and it was a newer form of a vaccine. I think but still, it was something that just became so political, and it was interesting seeing the dichotomy. I mean, we had pregnant physician females getting the vaccine with some unknowns, right? And they were willing to do that, and then you had other individuals who were refusing it. I'm like, this is just wild.
I mean, that just, I know we're in the mental health field, but it just goes to how some people, how they form their opinions, what happened in their life to make them form these certain opinions, and take them as fact. Dr. Fauci, they did the research. They were looking at data to make, these were not opinions. These were facts based on the research. And people just could not accept it. Why? I mean, when did science become, maybe.
Maybe with the shutdowns and everything that happened, us having so much restriction, it was some form of control. People maybe they felt like they had, they felt like this is a way I can control.
I mean, people have control over their bodies, but once you're talking about a pandemic, I feel like the rights of the individual become less. I mean, not to take anybody's rights away from them, but what you do impacts the people around you. Yeah. It's not just you. Okay, you decide not to do that, but then you not doing it, that means your child could then infect my child.
Yeah, 100%.
What about my rights in that situation?
Yeah,
Yeah. Don't I have a right to protect my child?
Yeah.
Protect myself from you?
And not get sick? Yeah.
Yeah, where was the American spirit?
I was surprised by the divide.
The nationalism.
Yeah, and so, I mean, it came and went, it happened, but we're definitely past all that at this point, but hopefully a once-in-a-lifetime experience.
Y'all get your vaccines out there.
Yeah. All right, everyone. Thank you.
Till next time.
Bye.